Welcome everyone to Baycare Presents. Today we're going to be discussing Can Your Joints Predict the Weather? We have Dr. Bagrova, and she is a board certified internal medicine and a fellowship in rheumatology. She got her doctorate in medicine from University of Florida and completed her internal medicine residency at Duke University in North Carolina. She also did a fellowship in rheumatology at the University of South Florida, so local lady. She loves to evaluate, diagnose, and treat rheumatic diseases, and she wants to be able to be passionate and focus on being patient-centered so she can tailor her care to each person's needs and whatever their circumstances are. And she also loves to give back to the community, so she volunteers often to help with the underserved community. And we are very fortunate today to have her share with us a little bit of her knowledge. So I'm going to turn this over to you and Dr. Bagrova.
Thank you so much. Hello, everyone. My name is Anastasia Bagrova. I am a new rheumatologist here at Baycare, and I am
You did mute yourself.
I thought I muted myself. Okay, starting over again. Hello, everyone. I'm Dr. Bagrova. I'm the new rheumatologist here in Clearwater, and I'm excited to discuss with you today one of the most common diseases in general, and certainly one of the most common diseases we see in rheumatology, which is arthritis. Jump right in. So what is arthritis? We're going to start with the very basics. Of course, it comes from Latin, the combination of the word arthron, which means joint, and itis, which means inflammation. So arthron plus itis, arthritis, inflammation in the joints. But of course, as all things in medicine, it is not that simple. There are about 100 types of arthritis, which makes it really complicated and also really confusing for patients whenever they're told they have arthritis. But what kind? There are many ways to divide this type of arthritis in different buckets. For example, we can think of it as primary arthritis, meaning arthritis that arises from the joint itself and causes issues, or secondary arthritis, meaning something happens to the joint that causes us to get inflamed and sick, such as surgery or trauma. We can think about it as arthritis affecting just one joint or multiple joints, and there are different diseases that can do either or both. We can think of it as arthritis affecting just children or just adults or both. We can think of arthritis affecting the spine or joints outside of the spine. But the easiest distinction that has the most impact in figuring out what's going on and how to fix it is the distinction between inflammatory arthritis, meaning the immune system attacking the joints, or non-inflammatory arthritis, which can still cause a lot of pain, but it doesn't come from immune system attacking the joint. So let's explore this further. Some of the features of inflammatory and non-inflammatory arthritis are listed here. It is more complicated, but this is a really good kind of basic description. And it is something that I think about too whenever I see patients in my clinic for joint pain. This is the first kind of step that I need to determine. Do they have inflammatory or non-inflammatory arthritis? So we will start on the left side here with the inflammatory arthritis. I'm going to I'm going to change to a highlighter so you guys can see better. So in inflammatory arthritis, the keyword is inflammation, right? Which basically means that there's a lot of joint swelling. And I'm going to show you a picture on the next page right here. This is from Dr. John Koch, who's a rheumatologist in Texas and does a lot of medical education. So this is a bunch of pictures of patients with rheumatoid arthritis. And you can see that their joints kind of look really boggy and swollen. And if we touch the joints, that they feel kind of soft and squishy and warm. So that's a critical feature of the inflammatory arthritis. There's a lot of pain, a lot of swelling and warmth. And because of all this swelling that is going on, it causes a lot of stiffness. Stiffness meaning the joint is so swollen that it is hard for it to move. So patients often report difficulty making a fist in the morning or whenever they wake up. So after periods of inactivity, everything just kind of the fluid that is very swollen and makes it painful in the joint accumulates when the joint is not being moved, and it gets really hard to move the joints. With that, pain actually gets better with activity. So patients would report that their worst time is when they just wake up or after they haven't moved for a while. And then towards the end of their day is when they feel better after moving. Maybe they've exercised or just did the things that they had to do during the day. This happens again due to immune system attacking the joints and causing the inflammation, and that can be due to multiple reasons. There are diseases that I treat, autoimmune diseases, where the immune system just decides that the joints are bad and starts attacking them. It can also happen as a part of infection when there's bacteria or viruses in the joints. The immune system goes to the joints to kill them, and that causes a lot of inflammation. Kind of if you guys think about when you have a sinus infection, right? Everything gets swollen and big and red and unpleasant, and that's basically what happens in the joints as well. Cancer can also cause the immune system to get activated and try to kill those cancer cells. And then some big drug reactions can also cause inflammation in the joints. A classic example of inflammatory arthritis is rheumatoid arthritis, and we're rheumatologists, so that is what we treat, but there are many, many other examples of that too. Now let's move on to the non-inflammatory arthritis part. There is still some joint swelling that is possible, but is generally much less severe or frequent than in the inflammatory arthritis. Patients experience a lot of pain, but they don't have quite as much swelling or warmth. They can still have some stiffness in the morning, and I'm sure we've all experienced that when we wake up and everything kind of feels stiff and doesn't move really well, but that should resolve in less than 30 minutes. And a very big distinguishing feature here is that patients with non-inflammatory arthritis experience pain with or after activity. So patients with inflammatory arthritis feel better when they move. Patients with non-inflammatory arthritis feel worse at the end of their day, or if they've done activities that they don't usually, like they've done a lot of gardening or building furniture or just some sort of increased activity compared to their usual day-to-day. This occurs due to wear and tear arthritis. Unfortunately, all of us accumulate damage in our joints from using them. It can happen due to injury or surgery, due to overuse. For example, athletes that throw overhead a lot can develop arthritis in their shoulder, which is unusual in the general population, or when there is stuff that accumulates in the joints that is not supposed to be there, like iron or calcium or other stuff that kind of accelerates the damage to the joint. And the classic example of arthritis like that is osteoarthritis. And we will focus a little more. So this is the picture of classic osteoarthritis, where you guys can see there's a lot of these bony changes. Unlike inflammatory arthritis that tends to destroy the joints from all that inflammation going on, osteoarthritis actually tends to make more bone. That's why all these bony changes, and that is the type of swelling that can be called colloquially, but it's really just more bone there that doesn't change, it doesn't go away. So we're going to focus the rest of our talk on osteoarthritis because it is by far the most common type of osteoarthritis, and at least 32.5 million adults in the US are affected by it. And I think this is a gross underestimation. Some of the risk factors for osteoarthritis include joint overuse or damage. For example, I think all of us at this point, or most of us, spend a lot of our days typing or texting. So we get arthritis in our fingers. Playing professional sports, depending on type of the sport, certain joints may be more affected than others, and certain joints may be more injured than others. I grew up in Europe, and then I moved to the United States, and now when I watch American football, the type of injuries that these athletes get are just awful, and I look at them and I think, man, that is going to hurt 10 years from now. In addition, hyperflexibility, either being kind of naturally what we call double jointed, when patients are just really, really flexible and tend to have joint dislocations, or participating in sports like gymnastics or figure skating or dancing, when there's a lot of flexibility that's required. Unfortunately, that also leads to increased damage to the joints, because when the tendons over joints are very flexible, they don't protect joints as much from damage. Unfortunately, age is the biggest risk factor for osteoarthritis. Most of us develop joint damage from using them throughout our lives. As many diseases, again, unfortunately, osteoarthritis is more common in women and women over 50. Carrying some extra weight puts a lot of pressure on our weight-bearing joints like hips, knees, and toes. And then genetics can also play a role. We see that people who have arthritis in their family members, especially in their female family members, like their mothers, tend to get more osteoarthritis and a little bit earlier than those who do not. Now, as I mentioned, osteoarthritis is very common, but it is important to kind of be aware of some of the red flags. So even patients with osteoarthritis can get more scary forms of arthritis, like inflammatory arthritis that we've described. So I want to tell you about some of these to think about for yourself, for your relatives, for your patients, if you see patients. So if there are symptoms of prolonged morning stiffness, right? So more than 30 minutes to an hour, joint swelling in the morning or with waking up, improvement with activity, any associated rashes, that is concerning for inflammatory arthritis associated with autoimmune disease. And these are the type of patients that need to come see me in the clinic or another rheumatologist. Now, the scariest of them is when the joint just gets acutely swollen. Just one joint gets really hot and swollen and red, and you feel sick with fever and nausea and just really out of sorts, especially in people who have other condition like diabetes or rheumatoid arthritis or otherwise compromised immune system, or if they have prosthetic joints that get inflamed. This is very concerning for infection, and it is an emergency. It needs to be addressed right away because an infection sitting in the joint for just 7 days untreated can cause irreversible joint damage that is very severe. So in this case, I would just recommend going to the emergency room, or if same-day appointment is available with an orthopedic doctor or a rheumatologist who can, draw the fluid out of the joint, look for infection, that's acceptable. But generally, going to the emergency room is the fastest way to get care. If there is an acutely swollen and very painful toe, this is also called podagra, or knee, it can also be gout or pseudogout. Could also be an infection, and there is no way to distinguish those two unless a fluid is taken from the joint and looked under a microscope. So again, this needs an urgent appointment that is same day, either in the emergency room, primary care office, rheumatology office, orthopedic office, but this needs to be addressed right away. And then finally, this is rare, but can also be very concerning if there are fevers, rashes, rapid weight loss, trenching night sweats. That could be a sign of cancer. And some of the kind of more aggressive cancers like leukemia, which is a cancer of the blood, can also affect the joints. And in that case, an urgent evaluation with the primary care doctor or in the emergency room if someone's very sick is important. All right. Now that we've figured out what osteoarthritis is, what are some of the red flags to watch out for, let's talk about how to make osteoarthritis better. There are several pillars that have been established by the American College of Rheumatology and have been shown in clinical trials to be successful in treatment and management of pain in osteoarthritis. So we're going to start with the physical approach, and that basically means exercising, any assisted devices such as canes and kinesiotaping, and weight loss. So staying physically active is very important for the joints, although doing physical activity that may be too stressful for the joint can exacerbate pain. Doing physical activity that is supervised by a physical therapist or an occupational therapist, where you make sure to use all the right muscles and maintain the correct form, can be really helpful in making arthritis pain better and preventing arthritis from getting worse. Next is a psychosocial approach. The good news is that we can make osteoarthritis pain better. The bad news is oftentimes some degree of pain still remains. And I'm sure we've all experienced that when we're in pain. It makes our mood worse. It makes sleeping difficult. If we don't sleep well, the mood gets worse even more. The pain gets worse from not sleeping. And then this vicious cycle is just never ending. So studies show that in addition to exercising and trying to stay active, undergoing some sort of therapy with a mental health professional or doing group therapy where kind of share experiences with other people who are going through the same thing can be very helpful. In addition, combining sort of the psychosocial approach and physical approach and doing mind-body therapy like yoga or Tai Chi or acupuncture could also be very helpful for pain and stress relief. And finally, there are topical and oral medications that are available to help with pain, as well as joint injections. Let's dive in a little bit more into the importance of exercise. Studies show that a combination of aerobic exercise, meaning anything that gets your heart rate up, walking counts, cycling, swimming, running, chasing your kids around, all of that counts. As long as the heart rate goes up, this is great. That's aerobic exercise. Then strengthening exercises are also really important. That is using, small weights, big weights, your own body weight, whatever it is that you prefer, but makes the muscles stronger and helps protect the joints from damage. Stretching is very important as well. We want muscles to be strong, but also flexible, not too flexible, but doing things like yoga, Pilates, and so forth to stay flexible is very important. And for those of you who like to go to the gym, like to lift weights, and it makes you feel good, it's still really, really important to stretch before and after, and to make sure to include some stretching exercises in your daily routine. And finally, balance training. As we age, our balance tends to be impaired for multiple reasons, and it's a huge risk for falls and joint damage and inability to participate in, exercises and being active and in social activities. So balance training is also really important. As I've mentioned multiple times already, studies show that supervised training is very important. So taking advantage of our wonderful physical therapists and occupational therapists. I am very lucky in our building at PTAC at Morton Plant. There is actually a physical therapist on the same floor as my office, so I can just send patients straight there, and they're so wonderful and so helpful and can devise a really great exercise program that is safe and that makes patients feel better. They can also advise on proper assistive devices such as canes that are measured exactly to patient size, knee braces, kinesiotaping, etc. And again, as I mentioned before, we know that staying active improves pain, improves function, improves mood, improves sleep, and not within my specialty, but studies also show that it helps prevent cancer, helps prevent cardiovascular disease, maybe even helps prevent Alzheimer's. So very important to stay active as much as possible. I want to also mention the importance of weight loss. We know that for every 1 pound of weight loss, there is a 4 times reduction in load per step on the knee. So it doesn't have to be anything dramatic, but just losing a little bit of weight can be really helpful. We know that weight loss of 5% causes 18 to 24% improvement in function. I do also want to mention that weight loss goals need to be individualized to every single patient, and they can change throughout our lifetime, right? So it's not what society tells us, it's not what Hollywood tells us, it's what's important for each individual patient. And this is where your primary care providers, your endocrinologists, any doctors that are treating you can be really helpful in trying to figure out what your goals are and how to achieve them. All right, and finally, there are some topical treatments available over the counter that I'd like to discuss with you, with the caveat that I recommend any new medications to be discussed with your medical provider. Just because things are sold over the counter doesn't mean that they're universally safe. So it's always good to review, your medication history, your medication list, and what medications you'd like to take with the medical provider. But some of the topical treatments that have been shown to be helpful are heat and cold therapy. So you can use ice packs and heat packs, no more than 20 minutes at a time. And then physical therapists can do really cool things with ultrasound and electrically delivered heat to help with joint pain. Another form of heat therapy is paraffin bath, and it has been shown to be helpful in hand osteoarthritis. So it's basically just a basin into which one pours paraffin, which is what candles are made of. And as long as it's not too hot, you can stick your hands in it, and it's very nice and very helpful. Occupational therapists also can provide some advice on how to do that properly. There are over-the-counter treatments like Voltaren gel. I recommend it to most of my patients. I use it myself. It can be applied to joints 2 to 4 times a day. It does need to be reapplied because it tends to wear off. It's a really nice gel. It doesn't smell too much. It is an alternative to oral non-steroidal anti-inflammatory drugs like ibuprofen and naproxen and Advil. As any topical treatment, it can cause a skin reaction. So I would recommend, doing a little test, like applying a little amount on your skin, making sure you're not reacting to can be used. It also needs to be used carefully in patients who have allergies to NSAIDs, liver disease, or kidney disease. If there's liver or kidney disease, then maybe fewer applications a day is better. Again, talking to a medical provider about this is always very helpful. Another over-the-counter treatment is capsaicin gel. So that's basically a substance that's extracted from hot peppers. So when it's first applied, it burns, and then it causes pain relief because it basically causes the nerves to not feel pain. There are some recommendations to avoid it in patients with asthma, but otherwise, other than, again, local skin reactions, it doesn't cause a lot of side effects and can be really helpful, specifically in knee osteoarthritis. All right, so as a summary, we've discussed that there are many different types of arthritis. There are some red flags, which we all need to be aware of, and they need to be taken care of very quickly, such as swelling, warmth, redness, fevers, weight loss. They raise suspicion for a more sinister cause of arthritis and should prompt an urgent evaluation. Osteoarthritis is extremely common, and it can be treated successfully with a combination of physical, psychosocial, and pharmacologic approaches. If you'd like to know more, or if you have someone to refer, here's my contact information, phone number, fax number. We're located in the PDAC building at 430 Morton Plant Street, Suite 100. For those of you familiar in the area, I hear that there used to be a sleep lab here, but also our location is super convenient because we're right at the garage. So if you're exiting the building, we're the last office on the left to get to the garage, or entering the building from the garage, we're the first office you see. And I'm happy to answer any questions, help with any patients, any concerns. We're here for you. Now we can go to questions and answers.
I am going to take just a second to turn off the recording as we go to the questions and answers.